Okay, we're connected now.
Yes, happy Friday.
Happy Friday.
So we're I guess are we 2 or 3 weeks into this lockdown? We're a couple of weeks into this lockdown.
On
And
Monday, on Monday it'll be 3 weeks.
okay, so and the numbers are the highest it's ever been. And I hate to sound like a broken record, but this is a question that everybody asked me to ask you is do you think we'll be getting out of the lockdown December 21st?
Well, it's not going to be up to me, as you know, it's a provincial decision. So my guess would be as good as anyone's. I said at the beginning of the lockdown that I thought it was not focusing on where the transmission is actually happening in industrial settings. So the fact that numbers have continued to go up, I think, validates that concern that if you really want to get numbers down or at least plateau them, you need to provide tools to where the transmission is happening in Peel region. There was a great editorial in the Globe and Mail just yesterday where they actually used a few of the quotes that I've referenced, that if you look at food processing, transportation, logistics, what we need is paid sick days, we need more testing, we need more compliance, we need an isolation center to really focus aggressively on where the transmission is happening. I feel that some of these restrictions are focusing on areas where there really hasn't been transmission.
So let me ask then, why isn't the province doing this?
Well, ultimately, they get their inputs from their healthcare advisors and stakeholders at a provincial level. I hope that they've used this period to rethink their approach. I think they probably assumed that the numbers would go down, and the fact they haven't, hopefully, suggests that a different approach is required. I believe a more surgical approach focused on the industrial settings, focused on the essential workplaces where we have significant workplace outbreaks and significant transmission. I think an approach that focuses on that aspects of Toronto and Peel would, and frankly across the GTA, would be more effective.
So in Brampton, do you see Brampton getting the first rounds, not the first rounds, but when the vaccine comes out on a mass, do you think Brampton will be one of the first cities to get it?
Well, the government said that it would go to the areas that are hardest hit first. And so following that logic, the first vaccine should be going to Peel region because we have a higher positivity rate. I have some concern that the initial storage and rollout is taking place in downtown Toronto and Ottawa, given the fact that downtown Toronto and Ottawa don't have near the positivity rate, don't have near the community spread that you have in Peel region. And so I've been assured, I've called and asked about that. I've been assured that the rollout was going to begin next week in Peel region, and that the details are going to be announced later today. But if that's not the case, know that I will be very vocal in my displeasure.
So they did say that it was coming to Peel then? Is that what you
That's
just said?
that's what I've been assured.
Yeah.
But until I hear it announced, I'm going to be watching this very closely.
Okay. Once the mass rollout comes about within all regions, will the city of Brampton or the regions have a role in the distribution of the vaccines?
We've offered whatever logistical support they need. Right now, we haven't been tasked with any responsibilities, but we've said if there is municipal properties, regional properties, logistic staff they require, we're happy to help in any way. Right now in Ontario, the rollout is being run by General Hillier, and we've offered our assistance.
Do you know General Hillier?
I met him in passing. He certainly has a very impressive reputation.
Okay.
And so I think they have tasked this responsibility with someone that has significant experience in logistical rollouts.
What's the latest on the Brampton Isolation Center, or should I say the lab? Did I lose you, Mayor
You,
Brown?
you froze there for a second, Khaled.
I think I got you back. There we go. Okay, got you back. So, did you hear the question?
Yeah, we don't have an update on an isolation center for Brampton. We've continued to pressure the federal health minister to provide one in the east end of Brampton, and we hope that it will be coming soon.
Okay. What are the hospitalizations like in Brampton right now?
Well, we continue to be at 100% capacity. They're shipping patients to other hospitals. Our acute care capacity, which is what we look at more closely, is about 90%. So there's not a lot of leeway for additional pressure on the hospital system.
Okay. And will bylaw officers be out in kind of full force or even more full force in the holiday season, the Christmas season?
Yeah, our director of bylaw enforcement, Paul Morrison, has said they've provided additional staffing to make sure that there's not any large Christmas parties or New Year's Eve parties. The last thing we want is additional COVID spikes. We had it at Thanksgiving, we had it at Labor Day, and we certainly don't want it again.
What would happen in case, I mean, if these are large household gatherings, is it just more of a knock on the door, kind of like, hey, can you stop the party, or can they walk in?
Well, at first it's done through education, and then fines if education doesn't work. And if the fines aren't working, then the police come. So if someone's having a 100-person kegger, the first thing that they'd be told is to shut down. They'd be fined, and if they refuse to, then the police would come.
Okay. City of Brampton approved a budget, right? What does that mean for the residents? I think there's a lot of line items there.
Yeah, so I made a commitment in the last municipal campaign that I wanted to ensure we were careful with taxpayer dollars, that we became tax competitive. When I ran for mayor, taxes in Brampton were among the highest in the GTHA. And so we're gradually trying to make the city more tax competitive. So in the first 2 years, we ran tax freezes, the first time in 19 years. And now in our third year, we've been able to run a tax freeze again. So this is 3 straight tax freezes in the city of Brampton, which is very much unheard of in the municipal world, where there's pretty consistent tax increases. I felt, especially this year, to putting new cost on residents would be the absolute worst timing. Right now, people have lost jobs. They're struggling because of COVID financially. People in public sector positions, maybe it hasn't affected their day-to-day lives, but everyone else in the city, this has been a really, really hard year. And so we want to make sure there's no unnecessary pressures caused by the municipality. And that's why I thought it would be appropriate to have a tax freeze, and grateful that our city council in Brampton unanimously supported it. I chaired the budgetary process, but my vice chair was Councillor Paul Vicente. He did a lot of heavy lifting as well. So thank you to Councillor Vicente for his work on that budgetary process.
Any other major line item about the budget?
Well, there's going to be new soccer dome, cricket fields, new investments in active transportation. We made a record investment into the reserves, which is sort of our rainy day fund, our planning fund for infrastructure. We also continue to have some enhanced winter maintenance protocols. We are planting 50,000 trees a year as part of our environmental plans. We've recommitted to do the backyard garden program again. So there's lots of exciting new initiatives in the budget as well.
Cool. I'm going to get to Instagram viewer questions that I posted my face this morning and got tons of questions. So I try to get weeded out in the sense that they're directed to you, as in a lot of people get confused about jurisdiction, right? So does Brampton have the ability to shut down schools? So I'm thinking, does Dr. Lowe and Peel Public Health have the ability?
No, that's a provincial decision. And so that would be the Minister of Education, Stephen Lecce, and the Premier. We don't get input into that locally.
Okay. What's your reaction every time you hear Bonnie says that she wants that appeal?
Well, she doesn't say that as much anymore. 2 years ago, the city of Mississauga embarked upon a separation from Peel campaign, but the province looked at the numbers and realized that it would cause tax increases in Mississauga, Brampton, and Caledon, because right now we pool the policing costs, pool the waste management costs, pool the water cost, and because we do that, we get a better value. If you're doing something for 500,000 people versus 1.5 million, usually the larger the contract, that the better value you can get. And so after that provincial review, I think most people in Peel have abandoned that request. So it doesn't really get brought up much anymore, as it did before when the campaign was in effect.
To less serious questions, but when do you think, well, no, this is pretty serious, but when do you think we'll be able to see a concert at Garden Square again?
Honestly, it depends on the vaccine rollout. I'm not sure whether we'll be in that position by next spring, but certainly I would expect it to be in that position for large events in 2022, maybe even the fall of 2021. I think large events will be the last thing that return, but I suspect they will.
Okay. And last question we have here is what is your favorite takeout since the pandemic?
Favorite takeout? Well, you know what? There's a lot of great options in Brampton. Lately, I've been really enjoying Queen Gypsy, which is Serbian food in our downtown. But if there's the place I probably go the most would be Caffeine in the Morning coffee. When I'm at City Hall, I usually get my Segovia.
Okay, cool. All right. Well, Mayor Brown, have a good weekend.
Okay, you too. Stay safe,
Take
stay
care.
healthy.
Thank you. You too.